Good afternoon, everybody, and welcome to the Building Back Better webinar here today. One of a series of webinars being hosted by Y Sports Media. This webinar will both help to keep you up to date with the very latest insight coming out of our sector, but also importantly, keep us all connected to one another in these very strange times. Today we'll be using the hashtag WS for sugar or Y Sports, BB Build Back 20. So please feel free to share your thoughts on social media today. You'll also see, I think it sits on the right-hand side of your screen, a chat option. We've got a Q&A at the end of our panelist presentations today. So as we're going through, if you have any questions you want to put to the panelists, then please feel free to add that into the chat box, and I will put as many of those to them as possible as we go through. In addition to that, we've got some opinion poll questions. So as our panelists are talking, there may be an opinion poll that comes up in your view on certain things. So feel free to contribute to that, and I'll be sure to throw that back into the conversation. Before we get into the presentation, the webinar today is being recorded, so you'll have access to this on a playback function and also the presentation of each of our speakers, which I know is hugely valuable for people either sharing within their organisation or indeed referring back to, and you don't have to make too many notes today. So, sport and physical activity has a hugely important role to play in the well-being of individuals and communities. Now, we saw the early importance of this during the pandemic, particularly at the start, when we went into lockdown, and I think it's safe to say it's been face throughout. So it's fitting that today's webinar is actually on National Fitness Day, and I'm sure many of you watch the activity on social media and indeed being part of it. I'm delighted that today we can take a closer look from a place perspective with a lens integrated health, wealth and well-being through the lives of residents that reside there. It's also a place where stark inequalities exist, and again we've seen that at the forefront of the pandemic in terms of impacting people and opportunities and access to opportunities. So we're really looking at how everybody can have access to opportunities in a safe and affordable way. Your panelists today are going to share their experience about their organisation, but also about their wider work as a city region and indeed feeding into the national context, navigating the immense challenges that people have been facing, but also creativity in order to re-engage people into being active and find a way to build back better. First up, you'll be hearing from the Chair and Vice Chair of GM Active. Now, for those that don't know, GM Active is a collaboration of the Leisure Trust operating across Greater Manchester, and an organisation that's done an incredible job to advocate for the sector, both locally and nationally. Now, Pete Burr is the Managing Director of Inspiring Healthy Lifestyles in Wigan, and he's joined by Andy, CEO of Linked Life in Rochdale. Pete and Andy are going to outline how they've adapted to the challenges posed by the pandemic, including the very immediate risk and the need to save leisure. And again, I'm sure people will have seen hashtag Save Leisure on social media. If you haven't, please check it out. Please get behind the cause. They're also importantly going to be sharing with you some really good examples of service redesign locally, county-wide, in the short and medium term, but finally highlighting the long-term contribution to the sector of public health of our population. So first up, I'd just like to over to you. I can ask our panelists who aren't talking to yourselves and remove the videos with distractions.
Okay, thanks Yvonne for the introduction, very kind. And if you look at the publicity that came out, you'll see my picture on the 20th of March this year and what I look like then, and compare it to what I look like now 6 months later. You'll see how much I've aged and how much the grey hairs come on. But anyway, enough of that. I just want to tell you a little bit about GM Active. As Yvonne said, we are a collective of organisations from across Greater Manchester that are all part of the same movement to get people more physically active. We represent the provider arm for public leisure right across the 10 local authorities of GM. We've been together 4 or 5 years now, and we are going to constitute formally this year as a CIC in our own right, as the work we do gathers momentum. And we deliver a wide range of leisure and wellbeing services across the city region. And our purpose, our stated purpose, is together we improve the health and well-being of our Greater Manchester communities. So this infographic just gives you a little bit about a pictorial really of who we are, the 12 organisations. In Bolton there are 2, and in the City of Manchester there are 2. But we're a whole mix of organisations, and we like to think that in the way that we collaborate, we move as one, and we've got quite a track record pre-COVID in actually doing that, and I'll expand a little bit on that as I go through, as will Andy. So, in COVID, the risks and challenges, as Yvonne started to outline, our first and most difficult task at the moment is to preserve and protect GM's vital range of leisure and wellbeing services. And if you're within the sector, and I know many of you are, you don't need me to tell you just how difficult the financial pressures are becoming as we work through lockdown, as we thought we were starting to come out. But now, as we face 6 months more of social distancing and some form of reduction and restriction in the way we operate, according to our esteemed PM last night, we've got 6 more months to face. So what that means is literally, for us as operators, every single day we operate, we are losing money. And the restriction that's been caused by social distancing is going to continue to do that. And the uncertainty going forward, because we don't know yet whether what we've got now is going to be it, or whether it's going to get worse, or whether we actually face further, more stricter local or even national lockdowns. But we've not sat by idly. We've been working together across the city region. Firstly, in terms of how we geared up for reopening. We've developed and implemented redesigned services with fully bookable spaces for people to exercise. We've made, I believe, some of the most COVID secure environments across the sector for people to exercise in. We've also sought the support of our 10 client councils, and working together with them, we've positioned ourselves across the sector to make that plea locally, nationally, work with our clients to see how we can support this sector to come through those financial challenges. We're working with the combined authority in terms of putting a comprehensive spending review funding bid together for the 3 years beyond this. And one of the key pieces of work that we've kicked off in recent weeks is working with the stakeholders across the city region, and in particular the 10 chief execs of the councils and the consultancy SLC to do a piece of work looking, one, at the immediate survivability, how we sustain the GM leisure infrastructure in its entirety, and that's not just the buildings, that's the services and everything that we provide. But how going forward, I think this is more important, and it's probably a theme we'll want to pick up as we discuss, how we maximise our contribution to the population health picture in GM. Andy will pick up shortly on some of the ways we're doing that, but for me, that's one of the things that we've done as GM Active. We've been there previously through our landmark schemes such as Prehab for Cancer, where we co-design with GM cancer programmes for patients diagnosed with certain types of cancer to get fitter before facing surgery, and then for us to help them get fit afterwards. So with the ability to help the population of Greater Manchester recover from this and build the resilience going forward. So that's a very quick potted sort of history of who we are, how we came together. Happy to take questions on that later. It's given you a quick flavour of the challenges we face and how we started our recovery. Lot to do, long way to go, but with a clear, I think, indication of some of the paths that we will follow down that co-design for future solutions. Andy, do you want to pick up from there, please?
Yeah, thanks, Pete. Afternoon, everyone. Yeah, so building on from the 12 organisations across GM that we work together collaboratively, we're now thinking, obviously, like everybody else, like where from here? Where do we go from here, and what can we build on? And some of the work that's been commissioned will help us think through that and hopefully come up with some answers and things. And there's also a national context, which I'll come on to in a minute, and possibly some controversial questions being posed, and also the time probably to think a little bit controversially and a little bit with some fresh thinking. I know there's lots of chats going on nationally in different forums and going on from there. And in fact, internationally, the first quote I've got up there was something that caught my eye over recent weeks. The Collective Leisure in Australia. I don't know them, but I really like the fact that they've got a very clear purpose statement, if you like, of intentionally training to tackle chronic disease, build resilient communities, and provide access to employment and training for people from marginalised communities. I thought that was brilliant and really summed up, arguably, where GM Active could be going, and possibly the sector as a whole, and define the sector. That's another discussion possibly for later. So from our point of view, for GM Active, just before COVID hit, we were just about to launch a new strategy. We started a few years ago as a collective. We've been through a bit of a journey. We've identified all sorts of things that we could potentially work on collaboratively together. And then sort of found that on the back of, Pete's already mentioned the Prehab for Cancer, which was a commission through GM Cancer to the tune of £800,000, that gave us a clue, really, that was the first properly commissioned piece of work across the GM landscape, which is where we want to be, really. So after some soul searching, we thought we really need to set our stall out to work on health and maybe relegate one or two of the other things that we could be doing collaboratively, or tackle it differently in terms of building an operational team up. And just as we hit COVID, we immediately had to deal with the operational challenges, particularly the reopening, and we did set up an operational group, which has been brilliant in terms of some of the obvious things that we can do working together collaboratively. So I think there's something there that we've learned that we won't want to let go. But strategically, and the real point of this really is that the health and well-being focus was agreed by the board, and something that is key, particularly when we look at COVID recovery. The fact that hopefully with a vaccine coming rapidly in the new year, that with the new focus really on health and fitness and well-being and being fit for the future and resilient, let's get set ready for a boom next year in people coming to our sector. But are we ready? That's the challenge. Are we ready, and are we doing enough? Is our proposition clear? And I will stray a little bit into some personal bits in a minute, which are not necessarily GM Active, but hopefully it might lead to some discussions further down the line. Our next thing, and something we were keen to work on pre-COVID, was a GM Active college, taking a few lessons from the GLL college, which is very, very successful, but really also looking at our Prehab for Cancer. And by this, the thinking there was that we had probably the cream of our health and fitness professionals had been trained by the Christie, the hospital, and were delivering this Prehab for Cancer commission. But we were very confident, we still are confident, that will be well, it is a very successful program. It will continue to be so, and we were just beginning discussions about expanding the Prehab for Cancer onto other cancers, but also taking the model about other conditions, which is exactly where we want to be. I've been trying to do this for 20 odd years in this sector, and we were literally getting somewhere. We're at the right table, thanks to Hayley and Greater Sport, getting us round the table where we've always struggled, and I know many of us do. But we also realised that we didn't have the workforce. If we were carried on like this, we depleted our reserves, if you like, of highly qualified professional people who could mix it with the health and cancer specialists and what have you. So we knew we had to grow our own. So we were working on that. Then the COVID hit. We had some money agreed through the local pilot. And we, through a discussion, again with Greater Sport and the local pilot team, we changed that that funding, and we worked with the Future Fit platform, which then led on to training our staff that are on furlough, and that's the Reactivate platform that's been sort of rolled out via SIMSPA across the nation. So that's fantastic. But we've got that platform now, so we're now going back to our original idea of growing our own staff and making sure that we can be fit for the future and be commissionable effectively. Another part of this is the collaborate even harder bit. There's all sorts of opportunities, I think, and arguably necessity to think, how do we collaborate even better than what we do now? And I think that's something that's going to cause lots of tough decisions really coming through about how we can actually do this, and yet not all merge into one big homogenous mass. Because the other thing I think we've learned, and our clients have learned, is that the flexibility, the ability to adapt our offer and work alongside council colleagues in particular on the community response teams is absolutely crucial. And we also know that hasn't been as easy as it could have been in some places. So I think that sort of intimacy that you have at a strategic level, at a local level, is really important. However, we do need to be conscious of the need to generate some more efficiencies. So how do we do that and yet actually manage to keep the intimacy and the locality based and place based approach really? And the question mark there on the last bullet point on this slide is the federal approach to collaboration. Something that's being talked about is can we share back of house services for those that are willing? And it won't suit everybody. And I think the lessons from GM Active is that you cannot hope to move everybody at the same pace on the same agenda. 12 different organizations, 12 different clients and partners all at the same time. You can't do that. So don't even try would be the advice. But what you can do is say, look, there's some options here for people to opt into when it's right and proper for them. And that's the type of thing that we're talking about. So the federal approach would be something around the lines of look for efficiencies back of house, but at the same time, keep the leadership, which is important, in the locality to work with council officers and others in the vicinity to make sure you've got that local effectiveness alongside the efficiency. So that's something that we've been knocking around, and we will continue to knock around. We've got some help to do that. And then that might lessons from GM Active and what be discussed or lead to some discussion topics nationally. Controversial bits coming up. Look out. Maybe not so controversial as a national wellbeing strategy for public leisure as a whole. So again, we say we're agnostic in GM Active. We don't get caught up now. We used to about what type of organisation you are. Are you a LATIC? Are you an in-house operation? Are you a national chain, a for-profit company, a trust? We can get caught up in all that, but what we've tried to do and what we've managed to do is say, if it's about GM and if it's about concentrating on the outcomes, then that's good enough for us, and we'll crack on with that. So that's how we can put a strategy together that crosses those organisational boundaries, and we're quite proud of that, and I think it's essential, to be honest. And yet, at a national level, we don't have a public leisure strategy. We don't even know what our sector is, arguably, because if you take the UK Active, and I'm not knocking anybody by this, by the way, but the UK Active splits itself into two. It's a membership-based organisation, but arguably, is it really the right way to represent ourselves and have a strategy for the public sector as a whole? I don't know. So a few bullet points there, picking that one up. The other side of it, I think, is differentiation from our proposition from the private sector. As time's gone on, we fight for the financial pressures. We fight for often the same, increasingly the same customer. But shouldn't our proposition be different if we're publicly funded, or even if we're not publicly funded but we're in public sector buildings? Is there an opportunity as well as a necessity to be different and to be sure that that proposition is clear to both commissioners, to local authorities, and to government? Not sure that it is at the moment. Can we co-design? One of the key aspects, if not the key aspect, was the successful Pre-Ab for Cancer is co-designed, has always been co-designed with the health professionals and the commissioners, and we tested it, we trialed it. It's got academic rigor behind it. It works. Maybe that's a platform, and I know there are plenty of others up and down the country, but that this is ours, and we're proud of it. Is that a template that can be used? We think it is. Social prescribing, I'm not quite sure where that is now. It's something that we think we should be right and centre of what social prescribing actually means. I don't think, and we don't think it means just giving a couple of hours free access during the quiet times during the day. That could be part of it. I think there's a lot more than that. So we're keen to make sure that we're fully involved in social prescribing, and maybe that's something that we do need to pick up and just define what our part of that is into play. Another one is the National Weight Management Programme. If we had a national wellbeing strategy, there's a lot of talk, Boris included, about the weight management programme, but we don't have one. We all have them. We all have them, I suspect, of our own, but we don't have a national weight management programme across public leisure. Maybe it's time we did, utilising our assets, because if somebody said there'd be a national chain of leisure centres with swimming pools and halls and community assets, they would snatch your hand off to put these weight management programs in, and we should be working on that, arguably. Diabetes, something that GM Active we've been working on to make sure we've got the links with the National Diabetes Prevention Programme, and more recently the reversal programs, which just got commissioned in GM just before COVID, so we'll be picking that one up as well. But again, we want to be, this shouldn't just be a bolt-on, this should be central to what we do. So we're putting these programs forward for people across GM for those that need it most. And not last but not least, I think the SIMSPA role, I think they've been fantastic, put their money where their mouths are over recent months. And maybe there's a bigger role for them in some of these things that we're talking about, and making sure that nationally our workforce can stand shoulder to shoulder with health professionals and make sure we're fit for the future. So that's our slides for today, in terms of hopefully that's given you some food for thought for later on and for some questions. Thanks, Yvonne. Thank
you very much indeed, Andy and Pete. Very encouraging to hear the approach. Obviously, I've had the privilege of being close to that over the years, and it's amazing to see how much that's progressed in terms of moving forward together as a provider network. But picking up on that point you made, Andy, which was around that local leadership and having that locality perspective, I think is so important. But equally, having a GM view allows for those strategic conversations to be somewhat simplified in terms of the engagement, not necessarily less complex in terms of the delivery of that. Some interesting views coming from the opinion poll, guys. In terms of the question posed around support for the operability from GM and National, overwhelmingly no, people don't feel there's been enough support. And again, that's why it's important to get behind the campaigns around Save Leisure, because if there isn't that support there and we're not speaking up as a collective voice, we're not being heard. So I think that's a call to action for everybody, I guess, to get behind that. Quite a mixed view on the perspective around people being able to survive and thrive beyond sort of COVID-19. Just over sort of 50% yes, with a little bit under on the no side. So a mixed view there. Hopefully from today you'll be able to see that there are people out there who are going through this with you and can share some amazing insight in terms of the learning from different parts of the country. So the sector has always been very positive around sharing that. So don't let today just be the start of the learning and the conversation. Please pick up with people, and I'm sure people will be happy to share contact details beyond today as well. I think the final point I'd like to sort of draw upon from the GM Active presentation was just around the flexibility. That you made a really good point around, yes, in an ideal world, everybody would move at the same pace, and it would be easy to have some back office services and that front facing local flex. But actually not every organisation is in a position where it can make those decisions at the same time, and actually to move forward effectively together as a network. That recognition is so important, and people will bring different strengths, different skills, and different relationships to the party, and ultimately we're as a sector here to serve the population and to support those people who need our help the most. So I think what you guys are doing is incredible. You know, from a Y Sports point of view, we absolutely want to get behind you and help us as much as we can to amplify that voice. I'll move on now, and then we can pick up. There's some good chat going on, guys, in the function. But again, don't forget to put your questions in there, and we'll pose those to Andy and Pete shortly. Next up is a good friend of mine, someone I've had the pleasure of working alongside, who brings huge passion, lots of curiosity, and a massive commitment to do things differently. So we have Hayley Lever, who's the CEO of Greater Sport and the exec lead for GM Moving. She's going to be building from what Andy and Pete have shared to discuss the wider kind of Greater Manchester system, and how they're moving forward with GM Active and others. And importantly, how that all links together under the umbrella of GM Moving. In particular, of interest, I think, will be the insight-led response that Greater Manchester are taking. And also, Hayley's going to be highlighting some of the principles of how we do things. Sometimes it's not what we do, but how we do it that has the biggest impact. And I know there's been a huge amount of learning from Greater Manchester from there. So, Hayley, I will throw it open to you.
So thanks for that, and thanks, Andy and Pete. It's actually really nice to sit back when we've been in so many meetings with each other over the last 6 or 7 months on a weekly basis. It's been really nice to sit back with Andy and Pete and Kate, who's following on, to kind of plan for today and think about where we're at. So as Yvonne said, my role is across GM Moving, and more recently as Chief Exec of Greater Sport as the Active Partnership, working across Greater Manchester. So GM Moving, for people who are not familiar, it's our whole system approach to across the whole city region to challenge inactivity and to engage people in active lives. And it is really about growing a movement, and so it's creating the conditions for a movement to grow in which everybody can play their part, everybody who lives and works in Greater Manchester, no matter which bit of the system they're working in. And this journey started back in 2014, 2015, when Yvonne was around in Greater Sport, and it's really kind of progressed and continued to grow and evolve with a lot of learning along the way since then. I joined in 2017 working on GM Moving, and we wrote GM Moving, the plan, around the time of Andy Burnham's election as Greater Manchester Mayor, and around the time of health and wider devolution. So it's been a really exciting time, and obviously this year has thrown a whole new dynamic into the mix, in which we've had to adapt and evolve as everybody else has, and take a really good look at ourselves to think what's our relevance and what's our purpose, and is our purpose the same as it always was in a world with COVID, and I guess what do we need to do differently, what can we carry on doing, which is just as important as ever, and how do we adapt and evolve to meet the new challenges and demands, which I'm going to talk a little bit about in a moment. So as you'll see along the bottom of that slide, just to see how kind of GM Moving comes together, there's a real partnership. It goes way, way beyond. There's hundreds of organisations involved in this work as part of the movement. But the GM Moving executive group is those organisations across the bottom. So from health to transport to Sport England to Greater Sport. 10GM is the community and voluntary sector organisations in Greater Manchester. GM Active, in terms of Pete and Andy representing today. And we come together to try and steer our way through growing this movement and taking a whole system approach to addressing inactivity. So this, I guess, where were we pre-COVID? We were making real progress. So together we were closing the gap on some key inequalities in inactivity. We had our best kind of active lives data over the last 2 rounds that we'd ever had in the whole time that active lives has been collected. And there was a real sense that the system's coming together. So real clear purpose, shared purpose, collective ambition, which I think you'll have got from Pete and Andy. And that same shared purpose is shared across the whole system. And particularly in the last couple of years, a real sense that the whole system approach has become absolutely business as usual for us in Greater Manchester, and that we don't think any differently. You know, it's just become a normal mindset and a way of working, which is just embedded for all of us in the way we do things, which has felt like real progress. And I think that kind of framing of the challenge of inactivity and support and enabling active lives is very much in the context of culture change and system change, as well as individual behaviour change, and that we need to be working at all of these levels all of the time. So we've made real progress, and there's a real comfort with the complexity of all of this and the kind of scale of 2.8 million people across Greater Manchester, and the fact that there wasn't one organisation and there wasn't one bit of the system or one individual or one leader who was most important in all of this. That it's genuinely all of us working together across the system to make change happen. So we were in a really good place and felt like we were making great progress. And then obviously COVID comes along, and I'll move on to that in a second. But the culture change bit of this diagram will be familiar to people, I'm sure. But the real kind of step over for me in the last sort of 12 months is recognising, and this is relevant to COVID, that actually we can change culture and norms and ideologies, and that is absolutely critical to the work that we're all doing. So if you just think in the context of COVID, how much of our language and our kind of hierarchy of values, what matters to us, has shifted and changed during this time, and how quickly we've adapted as individuals and families and organisations. Just shows just how possible culture change actually is with the right drivers, and you know, in this case, some real challenges that have driven rapid transformation. And I think there's a lot of learning in that for us if you apply that to our wider work and recognise that just by changing what we say and the words we use and the way that we articulate our message and our narrative can actually bring about great change without even investing any more money, which is an interesting conundrum in itself. So the impact of COVID, I guess, for us, there was definitely a kind of real wake-up call, you know, a stop and think back in March, which was quite practically speaking, you know, for me and our organisation and our team is how relevant is what we're doing in this COVID world. Because all around Greater Manchester, organisations that we work with all the time were redeploying, you know, either furloughing or redeploying their teams out to the front line, out to the neighbourhood response, out to community hubs. People across the system in Leisure Trust and other organisations have been, you know, redeployed into all kinds of roles to support the COVID response. And we took a view very early on that it was quite clear that GM moving was more important than ever to living with COVID during lockdown, but also to that whole concept that started to very quickly emerge, which is how do we bounce back from this and how do we live with COVID and recover and build resilience across the population at a time of huge uncertainty and threat and anxiety and change. And so we went through an exercise of, you know, what is it that we can continue to do, which is still really important, and we can do it exactly the same way we had planned, to what needs doing, which needs to be now done differently and redesigned in this context. And then what are the new things? So what are the new needs that, you know, that the insight is showing us matter more than ever, or the new needs that are emerging? So the growth in inequalities and the widening of the gaps in activity levels for certain priority groups during COVID became quite quickly apparent. So being able to respond and lift up certain things up the agenda was really important to our work. And so, like everybody, we've been adapting to the uncertainty and the constant change. But again, I think what's really struck me across the whole system in Greater Manchester is that absolute commitment to building back better, always a sense of optimism and hope that we can build this resilience and thrive again through all of this sort of process. But also what's been really interesting is just how much, and I know people around the country have seen this, just how much movement and physical activity has gone up the agenda in terms of the whole Greater Manchester system, recognising that people moving more is absolutely critical to physical and mental health and well-being, social connection, you know, people being outdoors and enjoying you know, open spaces and green spaces during lockdown. It's never been more needed than it is now. And the inequalities challenges that came through COVID, if you look at the data and you kind of overlay where the inequalities around COVID, where the communities that are being hardest hit by COVID overlay with the most deprived communities, the least active communities. So we've got a job to do to respond to what we now understand to be a bigger challenge than we ever had before around that. And thankfully, you know, that is higher up the wider Greater Manchester agenda as well. So there's a real recognition in the recovery plans that's really, really important. And Yvonne mentioned this, I suppose, in terms of the ways of working. There's been so much change and so much threat and anxiety for people and families and organisations that the one thing that we can hold true to and that is really strong in Greater Manchester is that sense of shared purpose and a set of values and principles and ways of working that have become normal to us. So the work we've been doing with GM Active and Sport England and others is absolutely based on a set of principles and ways of working and trust and honest relationships and collaboration that Andy talked about. And I think, you know, when everything else is in flux, that's something that's really secure that we can all hold to. And I guess the other thing that's really struck me during this time is just how much people being kind and compassionate and supporting each other has become more culturally acceptable. So we might have always cared for each other before, but now it's okay to say so, and now it's okay to actually step over that line into wondering how people actually are and how people are coping. And I think that's humanised a lot of us in a way that's made it more acceptable to be open about. What's also been striking is how I've remember some stories really early on from Pete and Andy and colleagues about the members of the teams who are out on the front line in the community hubs and the neighbourhood work and supporting communities in the food banks and all sorts of community response had had their eyes opened to different needs of communities, building relationships in communities that has not only served the community during COVID, but actually is bringing back a great deal of insight and learning, which can translate and come back into the work, which is something to hold on to because it will help to redesign some of these programs that Pete and Andy were talking about earlier. So we've learned a lot, and we can share some stuff after this, but we've learned a lot about the ways of working from our evaluation work over the last few years, and about how our own sort of leadership styles and behaviours and our collective leadership priorities really matter during this work and around the sort of whole system approach. So I won't talk through all of those, but we've got some stuff written about that, which I can share out. And I guess then just to kind of put this all in the context of the Greater Manchester Recovery and Resilience plans, one of the things that, again, has been going on around the country is every locality or every city region has come together to think about, well, what is it that's going to help us to build back better? How do we recover, become more resilient and live with the new world that we're in? So Great GM Moving and the system, who everyone is working on physical activity, were asked to contribute to that wider recovery plan. So there's a set of very clear priorities that sits within the overall GM recovery plan, which is really clear about how physical activity, people moving more, can contribute to that. So the sorts of things which are sort of important within that, you know, things around active travel. So how do you give people safe ways to walk and cycle during this period? The support to the physical activity, sport and the community and voluntary sector in the neighbourhoods and in the localities. Part of which is the piece of work that Pete mentioned earlier with GM Active. But then also across all of our areas of work, whether that's in education, whether it's in health, whether it's in active ageing, whether it's in the work with the Ageing Hub, what is it that the role that physical activity can play and people moving more in that resilience? And it's all kind of underpinned by a commitment to working to Marmot principles. So making sure that we are really, you know, really asking ourselves a question about what is it that the whole population need, and then what is that really targeted support, and work with particular demographic groups or particular places that need more input and more concerted effort to support. So that's kind of where we're at the moment. I guess one of the things in all of this is there's like every day, and even within any day, you've got a need to focus on the crisis, to fix and retain what's broken and rebuild on a very kind of nuts and bolts level, but at the same time, lift your head up and look to the long-term future. And we're starting to do that now around the refresh of the GM Moving strategy. And together we will, you know, keep making a difference on a day-to-day basis, but also with a view to where we want to be in 4 or 5 years' time, because it's got to be in that context that we are constantly thinking as well. So I'll pass back to you, Yvonne, now at this point.
Thank you, Hayley. Really interesting. So much to take out of that. I won't go into too much detail because we've got other speakers and I want to get to questions, because the questions are most definitely flowing now. Just a quick one on the opinion poll, and maybe something you can feed back into the national system, Hayley. There was a question around if people on the webinar feel they're receiving enough support from their local active partnership. A quarter of people polling yes. But nearly 2/4 saying they need more support. It'd be really interesting to get an understanding from people, if you can pop it in the chat functions, around what additional support you're requiring. And then perhaps Hayley can feed that into the National Active Partnership kind of network, because it's really important that active partnerships listen and are able to deliver that support back. In terms of some of the key points, just touch on a few. I think the reference around the culture change and how quickly it shifted. You know, I've never seen so many people walking and cycling. I've never cycled so much as when we were on lockdown. Fortunate to have bikes, fortunate to be able to cycle in some nice places. But, you know, how do we sort of maintain that? But the system has responded quickly. I think also important to note where you've got strong relationships embedded and you're working across system, whether that be across a group of similar organisations or right across the network, like in Greater Manchester, those relationships allow for that flexibility, is what I picked up, and the flexibility to respond quickly and to be able to kind of ensure there is a commitment to this agenda. People are asking a lot of questions, which we'll come back to, around that commitment. How do you measure the impact and different things like that, but how do you actually get people on the bus? And I think the foundations have been laid, and in times where there are crises, it certainly shines through. Again, lots around how we maintain and maximise the increased profile, prevalence, importance of physical activity and keeping people moving as a whole system nationally. Actually, how do we keep that on the agenda? And it's not a nice to have, it's an absolutely essential for everybody's long-term health, regardless of the pandemic that we're facing. So some really interesting points there, and lots of questions that are emerging as a result. I'm just conscious we'll move on quickly now to Kate from Sport England, and then we'll come back to some of those questions. So Kate is the local pilot manager for Sport England. She's going to bring a national perspective, particularly considering some of the early research that Sport England did in the early pandemic, and the learning from localities across the country as well. Looking collectively also at how organisations and places can inform future working around this common purpose of keeping it on the agenda, and the importance of getting more people, particularly those who didn't access our services before, or those who perhaps would benefit from accessing more. How do we make that a reality to reduce the inequalities? So Kate, I'll hand over to you.
Okay, so I just wanted to say before I start, obviously I'm Kate and I work for Sport England, but my role at Sport England is particularly to work alongside colleagues in GM. So I'd class myself, and Hayley will smile and hopefully nod at me, as part of the wider GM moving team. So what I'm talking about today is sort of where Sport England have got to within this pandemic. But it's clearly not just about me. There's a large team of people in Sport England who connect into Greater Manchester. I particularly do around the local pilot and other areas. And I guess the call out, if there's anyone else on the webinar from Sport England who wants to chip in, please do as I go through. But the reason I've titled the slide Local to National Picture, or my set of slides Local to National Picture, is because that is what my role is about. My role is about working alongside my local colleagues across Greater Manchester and trying to connect the local stuff into the national stuff and vice versa. Okay, so in terms of where Sport England were, I guess, at the beginning of the pandemic, but also where we are now, is around three areas really. So I'm going to cover all of them. The first one being support, the second one being research, and the third one being about our emerging strategy. So in terms of support, many of you will be aware that we provided a number of funding packages and continue to do so, and also funding flexibility for those partners that were already receiving our funding and might be struggling during this time. It's also worth saying that we obviously diverted very quickly funding into appropriate spaces where we thought we could support. The second area is guidance. So we've got our Return to Play group who work really closely alongside DCMS to translate government guidance for the sector, to try and be as helpful as possible to local authorities and national governing bodies who are trying to navigate new guidance as it comes out. And obviously following Boris's announcement yesterday, we've got a team of people who are working like crazy at the moment to make sure that we're getting messaging out and, I say, translating that guidance into frequently asked questions and things like that to support the sector. And we've also obviously been having to do that under local lockdowns as well, which clearly makes the picture even more complicated. I think the key point there is the messaging we're trying to put out is as much as possible, we're trying to be as supportive as we can be. But, you know, please keep drawing on us where you're struggling to find your way through. The third area then for support is in terms of campaigns. So we've had the Join the Movement campaign, but also now as we're going forward, as this situation sort of extends really, you will start to see, well, you will have already started to see within We Are Undefeatable and our This Girl Can campaigns, elements of us sharing around how people have been able to be active during the pandemic to try and motivate and inspire others to do that. And then finally, our role as an advocate really. So I guess this is probably the part of Sport England that isn't necessarily promoted that publicly a lot of the time, but we are standing side by side, you know, with partners like Public Health England and UK Active to really make the case and be an advocate for the sport, physical activity and leisure sector as much as we possibly can. Okay, so the second part I just wanted to cover was research, and the research is again we've been able to act pretty swiftly to start collecting some of this data from some of our traditional methods. So our ComRes survey is run, well, it was run weekly. We're now into sort of a monthly phase with some additional parts for key moments such as when the leisure sector was able to open. But what we're also doing is local colleagues. So there's a team of us locally that work with all the local delivery pilots. And we've been doing a lot of work to collect, I guess, the local stories of exactly what is going on, what people are being challenged by, what people are struggling by, and also the opportunities that people are seeing. So from people like Hayley, our colleagues in localities, Pete and Andy, we are sending those messages up, which is another element of our research. And I guess it's much more anecdotal, but it's really helping create a national picture of what is going on right across the country. I guess the three things we can really see coming out currently, so, you know, sort of right now, is one, definitely a fear still of being out, mixing with others and getting active. That particularly links to people with health conditions, but I do think that transcends more generally right across the population. And, you know, even on a personal level, I think I feel that, to be honest. The second is financial challenges. I mean, this is I would say is pretty obvious, but just that impact on people's personal situations and whether they now have the disposable income to be active in the way that they would prefer. And thirdly, and this one's coming out really strongly for women, is caring responsibilities and the effect that is having on people and their opportunities to be active. It's not just childcare, which I guess we'd all traditionally think of. It's also supporting family members with health conditions, parents, grandparents. But what we can see is that burden is very firmly on women from the research that we have collected. And then finally, but I think most importantly, is again, very similarly to what Hayley and Pete and Andy have talked about, is how we can use what we're learning now. And I mean that internally from the way we work as an organisation, externally as the way we work with partners, how we've managed to turn things around potentially much quicker than we would usually, how we're working much more across the whole organisation rather than in the directorates that we're organised in, is how we can use that learning to think about our future as part of our current strategy sort of shaping period. So if anybody listened to Tim's webinar, I can't remember if it was last week or the week before. If you haven't, it is available on our YouTube channel. But if you did listen to it, there were the 5 key things that Tim particularly wanted to highlight about where our future strategy would be shaping up, I guess. And just like Hayley mentioned in terms of Greater Manchester, when we started this work, we were in a totally different place. Our active lives results were brilliant, really positive, highest activity levels we'd ever seen. And we've gone from that into lockdown and, you know, where we are now, which is clearly a completely different place. But I think what is so important is we are trying to weave all that in to what our strategy looks like for the future and how we work with all the different people that we do work with for the future in a positive way. So, and it's also about how, you know, how we can do things fundamentally differently. So Tim's first point is about being an active part of building back better, and again, which reflects Hayley and Andy and Pete's thoughts. And that's really about how we can support people, and us as an organisation can flex, bend, shape, adapt, and think about how resilient we are for the future. And this has really given us an opportunity, I guess, to think about how resilient we are, not just as an organisation, but as a sector. The second is about our connection with health and really strengthening that. And obviously there's some great examples from GM in terms of the prehab for cancer work. And it's about working with people, yes, in the local places that we are really working with, but it's also about working with policymakers around all those different areas of health that we could have an impact: obesity, mental health, social prescribing. Thirdly, supporting those who need it the most. So Hayley mentioned in terms of the inequalities of inactivity, and that clearly is going to be one of our priorities going forward. It's something we keep hearing time and time again from the people that are involved in our conversations in terms of how beneficial they would find it for us to step further into that space. And obviously those inequalities tend to correspond with social inequalities as well. So it's how, as an organisation and supporting our partners, we really, really look at that issue in its broader sense and don't just get caught up in sort of inactivity as the challenge, you know, knowing all those different interactions of the different parts of the diagram that Hayley showed and people's lives generally. Then fourthly, it's about clearly the next generation. So children and young people's relationship with activity, physical literacy, really building the foundations for an active life and committing to that. And finally, about active environments. And I guess I would say, and I would say this as a personal reflection, is active environments, particularly outdoor space, has clearly been really, really important for a lot of people over the time of the pandemic. But in terms of the strategy going forward, it's about access, quality, places that enable activity in a way that people choose. But that doesn't mean it's just about outdoor space. It's about indoor space too, because it is about personal preference and how we can support personal preference and that huge mix of opportunity in terms of sport and physical activity as an offer. But what I will say, it's clearly not just about supporting those people who need it the most or doing new things. There is also a commitment from us in terms of supporting those people who are currently active, but would value our support to continue and maintain that habit. And the final thing I'll just say is this strategy sort of period where we're pulling this together, where we're having conversations, this potentially will never end. So by the beginning of the new year, we will have a lot more meat on the bones in terms of our framework and an action plan of where the strategy is going. But I think there is a real commitment that it's not going to be an on-the-shelf strategy that is done and dusted. It absolutely is a conversation that we will continue with all our partners for the future. And my final slide is just to say, if there's anything of that you're more interested in, our website is full of stuff. Thanks, Yvonne.